Sort of mass social distancing is one kind of order. Quarantine is a different kind of order, and isolation is yet another kind of order. You hear about all of us saying, oh my gosh, I'm isolated at home. Well, no, Tom Hanks was isolated. That's because he was sick with the actual disease. So isolation refers to separating someone off from all other people who are not sick or have been exposed, but we're not sure if they're going to get sick, because those people are in fact infected. Quarantine is separating people from the general population who we know have been exposed, and we're waiting to see if they become infected. The mass social distancing orders that many of us are under right now aren't like quarantine or isolation, which are identified at small groups or individuals. Here, mass social distancing and stay-at-home orders are used to protect the population at large from a disease that's got a foothold in the community, and we don't know yet we don't know enough about how the disease is spread to easily identify who's been exposed and who's been infected. All of these are being used at the same time.
Under current US laws, there's no guarantee that the vaccines will be affordable, even though a lot of the research on which the development of these vaccines has been funded through US taxpayer dollars, and even though the law says that in those cases there have to be a number of negotiations regarding things like price. Are you going to sell the vaccine at exactly the same price all through the country? What to do about populations that are not insured, for instance, or are underinsured? How are these vaccines going to get reimbursed through our system? So there is a number of questions that need to be discussed, and that the law says have to be discussed in advance, and they have not been discussed. They're not being discussed, and we know from previous outbreaks, this happened with Zika, this happened with Ebola. The public agencies involved in supporting this development have tended to shy away from those negotiations. They have tended to say, we don't know how to do this. We don't have the know-how internally to do this. So you have a branch of the law that's meant to give us treatments, cures, medical technologies that completely stood in the way of this happening, and just by sheer disregard of the law were these gentlemen able to solve a critical public health problem at the epicenter of the Italian epidemic. This is coming our way, right? As Professor Gatter was mentioning, the shortage of beds of medical technologies. So this is a particularly good time for us to be worried about how the law, instead of facilitating responses to outbreaks, may also stand in the way. Quite frankly, because many of the laws regulating the development of these technologies are either international or so complicated that amendments would have to occur at this point for the legal framework to change. There's really nothing we can do immediately to change the law. But again, the outbreak will come to an end, hopefully sooner rather than later. So these are some of the things to keep in mind. When we all resume something that resembles more of a normal lifestyle, one of the roles for you, one of the roles for lawyers, policymakers, advisors, is to look at these laws that, you know, whenever the next outbreak rolls around, and fortunately we know this is not an if, right, it's a when situation, we probably, I would say, should amend these laws and make sure that when a public health crisis arises, we are ready and we have the legal tools to respond to that.
And then as we go, and you're reading a bunch on social media in the papers about policy proposals, one of the things we have to do is make sure that every policy is based upon the data, at least the best data that we have. And that's why it's important, even as a law professional, to be checking in with the CDC, the Missouri Department of Health and Senior Services, the Illinois Department of Public Health, to learn the latest update of what we know about this disease, the way it spreads, and the protections that we can use against that spread.